everyone, I am Karen Joy A. Kirit, a second-year Bachelor of Elementary Education student. In this video, I will discuss the first topic of Unit 3, Typology of Learners with Special Needs, A. Learners with Intellectual Disability. In this topic, here are the learning objectives. At the end of the lesson, the students will be able to K. Define and know the various types of intellectual disability. S. Create a list of teaching strategies that cater to each type of intellectual disability using a graphic organizer. A. Justify the significance of understanding learners with intellectual disabilities. Each and every one of us are unique. We are not perfect because we have our own flaws and imperfections. We have our own strengths and weaknesses. Have you noticed there are learners who have unique characteristics, unique facial features, and different shapes compared to normal students like you? Alright, it is because they are learners with special needs, meaning to say they need more attention and more assistance for their development. Before anything else, let's first define what is intellectual disability. So, intellectual disability is a term used when there are limits to a person's ability to learn at an expected level and function in daily life. Levels of intellectual disability vary greatly in children. Children with intellectual disability might have a hard time letting others know their wants and needs and taking care of themselves. Intellectual disability can cause a child to learn and develop more slowly than other children of the same age. It could take longer for a child with intellectual disability to learn how to speak, walk, dress, or eat without help, and they could have trouble learning in school. Intellectual disability can be caused by injury, disease, or a problem in the brain. At this point in time, let's move on to the types of intellectual disability. They are known as the cerebral palsy and the trisomy 21. But before we proceed to the trisomy 21, let's first know more about the cerebral palsy. Cerebral palsy is a group of disorders that affect balance, movement, and muscle tone. Cerebral means the disorder is related to the brain, and palsy refers to weakness or a muscle problem. People with cerebral palsy can have mild issues with muscle control, or it could be so severe that they can't walk. Some people with cerebral palsy have difficulty speaking, others have intellectual disabilities, while many have normal intelligence. Here are some fundamental things we need to know about students with cerebral palsy. The first one is, most children with cerebral palsy do not have IQ deficits. It's a common misconception that a child who struggles to move or control movements, or in other words, a child who looks different, has a cognitive disability. More than half of all children with cerebral palsy has an average to above average IQ. It's important for teachers to realize this and not to assume a child with cerebral palsy is not as academically capable as others. The second one is the range of disabilities in individuals with cerebral palsy is large. So while there are many similarities between individuals with this condition, there are more differences. For instance, some can walk, others cannot. Some have limited vision, and some children are in pain. Some have severe cognitive deficits, while others have above average IQ. Teachers must get to know the abilities and limitations of each child and not make assumptions. The third one is, children with cerebral palsy need to be actively included. A teacher may not think about inclusion on a daily basis, but for a child who is at risk of exclusion, it needs to become an active part of the day. Teachers need to be aware of the issue and take active steps to help include those who are likely to be excluded. They can try by calling on a child during discussion, assigning a child a leadership position, and starting small and structured group activities and requiring all to participate. The fourth one is most children with cerebral palsy need more space. With muscle movement is a main characteristic of this condition, having enough space to move is crucial. Limiting spaces can lead to less inclusion. Classrooms should be designed to be uncluttered and with plenty of space between desks and other objects. The fifth one is rates of autism are higher in children with cerebral palsy. Children with cerebral palsy are at a higher risk for having other developmental disabilities, including autism. Teachers should be aware of this because they are not always diagnosed. The sixth and last one is students with cerebral palsy are more likely to be bullied. A student with cerebral palsy in the classroom. Teachers need even greater awareness of bullying so that they can take steps to prevent it or to intervene. Important things that teachers can do include establishing and enforcing rules in the classroom, intervening immediately when bullying is observed, and getting parents and administrators involved. How to teach children with cerebral palsy. First is understanding the child's needs. So, to understand their needs, we need to A. Get to know how the student experiences their cerebral palsy. Every child with this condition has different experiences, so it's always a good idea to know this before attempting to teach your student. B. Know their IEP plan. A child with cerebral palsy may have an IEP or individualized education plan. If you weren't involved in creating it, get to know the IEP before teaching the child. It will show where the child struggles and what he or she can achieve. That way, you'll be able to provide the best help for the child. This will also help you adapt your teaching style. You'll be able to involve the child as much as possible if you know their strengths and their goals. C. Make sure you know what to do in an emergency. A child with cerebral palsy may need more medical care than usual. Children with cerebral palsy may experience seizures or be at risk of serious falls. Make sure you know how to handle each scenario. Second, adapting the classroom. So you need to make them adapt to the classroom environment. That's why the following has to be observed. A. Place the child near you. If the child has a visual disability, placing him or her near or at the front of the classroom can help him or her see better and be more engaged in lessons. This can also help you keep a close eye on the child, supervise their behavior, and spot any emotional issues. B. Make the classroom as navigable as possible. Some students with cerebral palsy use braces, crutches, or wheelchairs to get around. If this is the case for your student, make sure they can access all parts of the classroom as independently as possible. If needed, provide extra time to navigate between activities and areas of the class or school. C. Lower the board if it's too high for the child. If the child is in a wheelchair due to their condition, lowering the board can help them to focus and learn better. If you're unable to lower the board, try changing the child's position or using other equipment when teaching. D. Minimize distractions. Children with cerebral palsy struggle to concentrate if there are too many distractions, such as noises and toys. Try to remove as many as possible. E. Get adapted equipment to help the child with independence. If the child struggles to write or type, try a small laptop or adapted keyboard. Alternatively, if they struggle to read, audio aids may be needed. Third, teaching the child. So we have to A. Make sure the instructions are as clear as possible. Some children with cerebral palsy may struggle to understand instructions if they are not precise or there are too many. Try to stick to one instruction at a time. To help aid the child's understanding of the task, use visual aids if appropriate and helpful for the child. This can be written or in picture form, depending on the child. B. Make sure the child is included at all times. Children with cerebral palsy may find it hard to find friends and join in with group work. They often get left out. This can upset the child and make them enjoy school less. To counter this risk, make sure he or she is included at all times. If you can't have them do a given task exactly as other students are, try to adapt it for their skills and strengths. C. Praise the child often. Cerebral palsy can lower a child's self-esteem and confidence, so praising them will help them become more confident in themselves. You could say, for example, "Great job on your work today." Use sweets, a small toy, or a reward chart to praise the child, if appropriate to the setting. Fourth, dealing with problems. So, A. Assure the child that they can come to you if they have any concerns. If he or she struggles to communicate, calmly tell them that they can come to you if they need any support. This can help your child feel more secure and comfortable at school. When he or she comes to you, listen and remain patient and kind. Try using visual aids or a notebook if you are struggling to communicate with the child. B. Communicate with the parents. Maintain an open flow of communication with the parents and anyone else involved in the child's education. Assure the parents that you'll always be there to help. Hear them out if the child expresses any issues that need to be addressed. Follow up with the parents about how the child is getting on. See whether there are any issues that needs to be addressed. Now, let's talk about the second type of intellectual disability, which is the trisomy 21. Alright, so what is trisomy 21? Trisomy 21, which is also known as Down syndrome, is a condition characterized by a distinctive pattern of minor and major anomalies associated with excess chromosome 21 material. It includes certain birth defects, learning problems, and facial features. A child with Down syndrome may also have heart defects and problems with vision and hearing. How severe or mild these problems varies from child to child. There is no cure for Down syndrome, but treatment is available to help your child. Here are some ways in teaching learners with trisomy 21 or Down syndrome. First, ensure learning is multisensory. Material that's presented in diverse sensory channels and includes auditory, visual, and tactile elements may be easier for a student with Down syndrome to absorb. Second, include plenty of visuals. Students with Down syndrome tend to be visual learners. Add supplementary images to handouts when you can. It is especially important to break out long blocks of text or diagram complex descriptions. Consider investing in some colorful charts to put up in the room and play videos with closed captions to reinforce content. Textual input enhancement can also be especially effective for a visual learner. Third, give them more time. No two individuals with Down syndrome are alike in terms of cognitive processing abilities, but most will benefit from extended time limits. It can take longer for students with Down syndrome to understand and absorb information and then commit it to memory. Provide additional assistance by having them repeat back what they have learned at the end of the lesson or in peer work. Fourth, encourage use of technology. Handwriting can be difficult from both a physical motor skills and executive function perspective. Encourage students to record material so they can replay class discussions and listen to them at home. Use tablets or computers to take electronic notes and employ a smartphone dictionary to provide entries that include audio and visual information. Lastly, encourage and motivate. Most learners with Down syndrome have to work harder than their peers to achieve the same results in the classroom, and they thus require plenty of encouragement, reassurance, and praise to keep them on track. It also helps if they are given special assignments designed just for them that provides them with opportunities for success. In conclusion, people with intellectual disabilities are capable of leading fulfilling and rewarding lives with the right supports and opportunities. It's important to recognize the hard work and dedication of families and advocates who have fought for the rights of individuals with intellectual disabilities and have helped to create more inclusive communities. By providing the necessary resources and assistance, we can ensure that people with intellectual disabilities can reach their full potential and participate in society in meaningful ways. It's crucial to continue advocating for their rights and working towards a more equitable and inclusive society. Here's my references. That's it for today's video. Thank you so much for listening. Bye!